Bienvenidos a Información es Poder. En esta ocasión estaremos conversando con el doctor Richard Besser. Él es el presidente y CEO de la Fundación Robert Wood Foundation desde abril del 2017. Anteriormente estuvo desempeñando una carrera muy distinguida en los Centros de Control de Prevención de Enfermedades CDC. En este segmento estaremos discutiendo temas muy importantes porque consideramos que la salud no es un privilegio sino un derecho. Y bueno, la meta es restaurar la confianza en bajo esta administración que la verdad ha puesto en tela de juicio y creado muchas dudas en padres y miembros de la comunidad en cuanto a las vacunas. Miguel.
Efectivamente, el doctor Besser es un pediatra, como él lo manifiesta, y uno de los temas principales que estamos abordando en estos días es el problema de la vacunación. Estamos viendo enfermedades que tradicionalmente estaban fuera del planeta, por lo menos en gran parte de la población mundial, y ahora nuevamente nos encontramos con enfermedades como el polio o como la varicela, de vuelta otra vez por aquí. Entonces, la recomendación que hace el doctor Besser, y que también hacemos nosotros, es que le dé las vacunas a sus niños durante la edad escolar, arrancando quizás desde muy temprano, desde los 6 meses hasta los 11 años. Vacune a sus hijos. Hay que restaurar la confianza en algo que ha sido efectivo desde siempre. No estamos en este momento discutiendo nosotros, en particular como Información es Poder, el tema del COVID. Ese es un tema completamente aparte, que en algún momento lo abordaremos, sin duda. Pero en este momento, en cuanto a lo que es la vacunación regular, haga vacunar a sus hijos. Y comenzamos aquí con la entrevista del doctor Besser.
It is absolutely heartbreaking to me, having worked at the CDC for 13 years with dedicated employees, to have to say, I do not recommend looking to the CDC for information around vaccines. The committee that was there was disbanded by the secretary, and the current committee is loaded with anti-vaccine zealots. Not every person, but for someone to come onto that committee who has no expertise in vaccines and public health, in how to understand the science of these infectious diseases, does not put them in a position to be able to provide the recommendations for the nation. So what we're seeing are other bodies step up. The American Academy of Pediatrics, I'm a member of that organization. They put out recommendations. They used to be almost identical recommendations to the CDC. They're not anymore. But I recommend that doctors follow those recommendations. Parents who want to know more about vaccines, vaccine safety and effectiveness, should look to the Academy of Pediatrics for that kind of information. I would not recommend looking at the CDC website. It is now full of misinformation and disinformation. And during my 30 plus years of pediatrics, I can say without a doubt, there was nothing that I did that had more proven value in terms of protecting and maintaining the health of my patients than helping to ensure that they were vaccinated fully and on time. That involved developing relationships with parents, being open to hearing concerns and questions and addressing those questions. And it was a lot easier than the times we're in now. A lot of mistrust in healthcare, in public health, developed during the response to the COVID pandemic. And it's hard for me to see the path towards restoring the trust that was damaged. But in that exam room with a child and a mom or a dad or a grandparent, whoever was providing care, that was a setting where there was trust and needs to be trust, so that a parent can ask their questions about the safety of a vaccine, why it's being given at a certain age, so that there can be a level of comfort. The challenge now is that we have, as our Secretary of Health, one of the nation's leading anti-vaccine advocates. Secretary Kennedy, before he was Secretary of Health, he founded one of the organizations that is really challenging the concept that vaccines are safe and effective. It flies in the face of science, it flies in the face of fact, but having someone in that critical role has damaged people's trust in vaccination in ways that we're seeing play out around the country. You can see in South Carolina the massive measles outbreak that's taking place. We saw it start last year in Texas, but it's not limited to those states. Viruses don't don't respect the borders of states. They don't care what political party you align yourself with. If you are not vaccinated, or if the vaccine happened to not work for you, measles will find you and measles will infect you. It is a really good marker for how well or poorly a community or a country is vaccinating. The meeting that was canceled for next week is the meeting of the Advisory Committee on Immunization Practices. That committee has played a very important role in public health in America. Typically that committee has been made up with some of the nation's leading experts in infectious diseases, in vaccines, in population health, in issues of health disparity and health equity. And they have reviewed the scientific evidence around each vaccine and have made recommendations. And when I was practicing pediatrics, I would look to see each year what the CDC recommended in terms of flu vaccine, in terms of COVID vaccines, in terms of the basic vaccines for children.